So this will be the lower trap performance test. So we want to see the strength or how the lower trap is working. So first things first, we're going to look at kind of having that thumb up to have the humerus and lateral rotation. We wanted about 135 degrees of shoulder flexion and or abduction. The key thing with the middle trap performance and lower trap performance, this is lower trap performance, is watching the scapula, right? So if Sam lifts his arm up, I'm just going to have him do it once, we realize if the scapula doesn't move at all, the posterior delt is essentially doing everything, right? So go ahead and relax. So you got to watch for, does the scapula actually even depress? We're already in an upward rotation, so that puts the traps in a really good position, especially the lower traps, okay? So go ahead and lift up for me. And you can see, like, he's very dominant here. His scapula doesn't move a ton. Go ahead and relax. But I also think part of it is from our pec minor testing, he's got an anterior tilt naturally, and that anterior tilt is going to make it very hard to get in this position. It's probably uncomfortable for him to be in that position because the pec minor is short or stiff. Okay, so you okay? Mm-hmm. So I'm going to have him come back one more time, thumb up, 135. Now think about this. If his scapula doesn't move at all, lower traps could likely be weak or long because his posterior delt he's used probably most of his life, right? So as he lifts up, we want to see that depression of the shoulder blade. Okay, and back down. And I can just put my hand on there, try again. And it does depress, so it is working, right? But it's just, the pec minor is limiting us to see much of what's going on. So again, the lower trap, typically weak on a lot of patients, you have them come up, and then if I give resistance, it would be very mean of me to go at Sam's wrist to push down, because that's a huge lever arm on a muscle that's already struggling because of the pec minor. Go ahead and relax. So a lot of times if the scapula is depressing, and I want to truly check for depression, I'm going to feel, go ahead and lift up. Does it depress? Yes. And then I'm probably going to push on the scapula. Hold that for me, Sam. I'm going to see how much rotation. Can he hold it? And he can. By me pressing on the scapula, I get a true reading of the scapula. If I'm pressing way out here, every muscle other than the lower trap is going to try to work. Okay, so that's kind of a quick review of the lower trap performance test. This test is super hard for a lot of individuals. So just be careful when you're applying resistance. And if they can't get into the position, probably most important to look at pec minor and other like pec major, some other tests that aren't allowing you to get into that position.